So thank you. I do want to change operating system, and hopefully Europe will get rid of the dependency on American softwares sooner rather than later. E-prescription and e-dispensation. This is similarly to the patient summary. This is also a service that has been running for a year, but as opposed to the patient summary, this is a fairly contained problem. In the regulation itself, it states that this is about the sharing of prescriptions and dispensing in pharmacies. So therefore, whereas the patient summary could basically include almost anything. So we were, I think at least I was initially considered myself lucky to be leading the work on the prescription rather than the patient summary. Anyway, on the e-prescription e-dispensation, what we had to consider is that there is existing regulation on the European level. So the Patient Rights Directive that has the Article 14 about e-health, which we know is going to end in 2031, that contains other articles which are still going to be relevant.
Tronco este pibe, sí que.
I don't understand that was said. I hope that was related to e-prescription.
I think it's your operating system, Daniel.
Okay, yeah, good. Yeah. Anyway, where were we? We were at that legislation has already regulates the e-prescriptions on a cross-border level. So, for example, that member states should recognize each other's prescriptions. That's there. So, and then the other part, similar to patient summary, there is already existing MyHealth EU implementation, and this is probably one of the most, like, of the two. It's the more used one, the service. Prescriptions are actually being sent and dispensed across borders in the European Union today. So this is not something to like easily make changes to a working system. We don't want to poke around there. But from the other perspective, the EHDS has a slightly wider scope than just cross-border. This is about all EHR systems in all member states. So we had to also consider how this would have an impact on the national level, where we know that there are different medicinal product legislation, and this is a member state concern. So we had to, in this work, tackle things like multi-line prescription. Some countries have in their regulation that a prescription can have multiple medicinal products, and there are also rules about how these can be dispensed. Some do not, and do not wish to see any multi-line prescriptions ever. We have different rules regards to generic prescribing. There are different substitution rules, and there are also different roles. So it differs between member states who are allowed to do what parts of what pharmacists may or may not do, and so on. That differs between the member states. So we needed to develop something that worked for all these different situations. Another thing, we had code systems. There is so our European Medicines Agency is in the stage of implementation of pan-European code systems, but the uptake in member states is also varying. And but we had discussions with EMA, and I think we reached an understanding, and mainly from their side, that we are actually developing something that is going to be relevant for use in also all EHR systems, not just the cross-border situation, which is the concern of MyHealth EU. And we have also a lot of the discussion was around the how much detail that we put into the to the models. So medication is one area where it's concrete. There are tablets and stuff, but it's almost fractal in nature. The more you scratch, the more difficult it gets. So therefore, level of details and also maturity of member states was a challenge. So among the achievements, of course, we had logical models for ePrescription and, of course, eDispensation as well. But then we also worked together with our colleagues in other work packages and other tasks to develop the models for the medication domain. So medication itself, like what information do you keep about the medicinal product, given the, for example, generic prescribing is sometimes not used in member states. Dosage, how do you express a dosage? We had to refine, so when you're prescribing, you could say something about the dosage. When you're administering, you're not doing repeats and stuff like that. So there's further work on the more detailed level for certain use cases. And then we also participated in supporting some models which related to medication, but was not part of ePrescription and eDispensation that was used in test results, imaging, and the patient summary and discharge report. So, for example, medication use and medication administration. And then we also collaborated. So, HL7 Europe had already started working on FHIR implementation guides for medicines, prescription, and dispense medical. MPD, which means something else in other contexts. So these are they are now published versions of these, and again, a great collaboration between Xt-EHR and HL7 Europe. Thank you very much. And